Key education points. How do you measure allodynia due to CRPS? How do you determine if a fourth-day infusion would be beneficial? How do you treat nausea effectively? What is the best exercise for rehabilitation? When is a repeat 3-day ketamine infusion necessary? Is there a role for narcotics, opioids, in treating CRPS?
So today is April 4, 2011, and you're here for the 3-day ketamine treatment.
Yeah.
And so what I want to do straight away is just kind of give a little brief history. And if I say something that's not accurate, please, Mom, Dad, just let me know, okay?
Okay.
All right. About a year and a half ago, roughly, you fractured your left ankle, correct?
Yeah, and my heel.
And your right, and heel, right. And you developed the RSD.
Yeah.
Now, they went ahead and did lumbar sympathetic blocks on you. We know they were good blocks because you got a warm leg, but you got no real significant benefit out of that.
Yeah.
Then you were seen by Dr. Giancarlo Barlot, who gave you a trial spinal cord stimulation. Since you benefited from that, you went ahead and had the permanent stimulator put in. It's helped your leg. It's helped your left leg, but you got this new problem, and it's a severe allodynia in your back, okay? Mm-hmm. So what we want to do now, if we can, just so while we're on that subject, I want you to stand up, turn around, okay? And I want Mom and Dad to help me get a good recording of that area that we just mapped out. So we can see both sides with the black marks right now, and that's where the allodynia starts across your back. And that's the worst of the whole deal right now. Am I right, Hannah?
Yeah.
Yeah, go ahead and sit down, please. All right, very good. Now, that's what our focus is going to be. Now, but you still have some ongoing issues with regards to function and pain in especially your left leg.
Yeah.
Okay. So the first thing we want to do now is want to run through a battery of exercises with you, okay? Mm-hmm. You're going to do the vertical finger test, do 2 fingers, stick them in your mouth, look straight ahead, don't follow me, and tell me if you're having pain anywhere in your head, your face when you do that. Anything on your head or face when you do that?
No.
Good job. Next thing I want to have you do is I want to have you take that right hand and put it behind your head. Keep your head straight, please. Are you having any pain when you do that?
A little bit, right?
Right in there? Good job. Okay, now do the left hand behind your head, please. Are you having pain when you do that?
A little bit.
Right in there? Okay,
Yeah.
Very good. Of course, that's where you have a lot of allodynia, isn't it?
Yeah.
Which extends all the way up to your neck, doesn't it?
Yeah.
Yeah, okay. Now, the next thing I want you to do is take that right hand out in front of you, please. I want you to open and close it using your thumb as fast as you can. Fast, fast, fast. Good job, Hannah. Good job. Now take the left side, do the same thing. Fast as you can. Open all the way. Open all the way. Atta girl. Good job. Good job. That's good. Good, good. Okay, next thing we're going to have you do is we're going to go down to your ankles, and I want you to get that right ankle rotated as best you can. Good, good, good. Wiggle your toes now. That's it. Hitchhike back to Colorado. There you go. Good job. Now rotate your ankle on the left side. Good, good, good. Wiggle your toes for me. Good, good, good. Hitchhike back to Colorado. Good job, man. Okay, next thing we're going to have you do is I want you to get up there by the door. Okay? Okay? And I just want you to take your usual 3 steps toward me, okay, and 3 steps back. 1, 2, 3. 3 steps back, okay, very good. Now, did you have any pain when you did that?
Not too much, just a little bit, right?
Right in the ankle, okay, yeah. Very good. Now, next thing I want you to do is I want you to go on your tippy toes 3 steps forward and 3 steps back. Your dad's there if you need him for balance. 3 steps back, please. Atta girl, good job. And did you have pain when you did that?
Still right in the ankle.
In the ankle, and it was more severe than just walking?
Yeah.
Okay. And then the last thing I'm going to have you do is I want you to walk on your heels, please. 3 steps. Atta girl, good job. It takes a little bit more balance to do that. Did you have pain when you did that?
A lot in my heel.
A lot in your heel. Okay, and I just remembered there's one other exercise we have to do. To do that, Dad, you have to come over and sit over here. It's another exercise, okay? This is a real test of what you can and cannot do. Okay, so do you see that, that black table over there?
Yeah.
Okay, I want you to leap from where you are onto that table. Can you do that? What is this? What kind of daughter is this? She can't do that? All right, then you better sit down.
Okay.
All right. Okay.
If that'll do it, you can. Yeah, go for it.
Yeah, grow some wings, right? Okay. Now, this is a time when we kind of stop for a second and see if there's any questions at all about what we're about to do here. Let's start with Mom over here. Any questions about any of this?
No.
Okay. Dad, how about you?
No, sir.
All right, very good. And how about you?
No.
Okay, now the last video we're going to do on you is going to be a very educational video, okay?
Okay.
But I'd rather wait till then to get into a lot of education with you, because then I'll have a better idea what you're all about, okay?
Yeah.
All right. Okay, Hannah, your mom's going to ask you some questions. Look over here at your mom. Look at your mom. Over here.
Where's Mom? I'm right here. Do you see me?
Hi.
Go ahead, ask her a question. Dad, then you can ask her.
What's your favorite hockey team?
Colorado Avalanche.
Okay, now your dad's got a question for you over here. Here's your daddy.
What is your sister's name?
Sarah.
All right.
How old is Sarah?
13.
Can I ask you a question?
Yeah.
I noticed that your dad here, he's wearing a red pullover shirt with 2 buttons on it. Okay? Can I ask you a question?
Yeah.
What did I notice about your daddy?
He has a red pullover shirt.
Yeah, what else?
Buttons on it.
Damn, you got a good brain. Do you know that? Yes, you do. Your brain is strong. Very good. Good job, Hannah. Good job. You want me to turn the light down?
I don't care.
You don't care? All right. Well, we'll leave it on because that'll make you wake up a little faster, okay? If you want us to put a little thing over your eyes, we can do that too, okay?
Okay.
All right. Now, I want you to do one more thing for me, okay? One more thing, and then I'll leave you alone. You see my hand over here? I want you to look over here at my hand. Look at my hand up there. Can you see it up there?
No.
You can't?
No.
All right. Are you seeing double? Huh?
Kind of.
Kind of? Okay. Very good. You did a good job.